Broadcast is now starting. All attendees are in listen-only mode.
Good evening, and thank you for joining us for our presentation on TriPollar radio frequency technology. I'm Travis Mahan. I'm the president and CEO of Lumiere Medical. We're the exclusive distribution, sales, and marketing company here in the United States for the technology. I want to just give you a little bit of background before I hand things off to Dr. Michael Gold this evening, who I know you've all logged in to hear speak on his clinical experience with TriPollar, and really what it is that's setting this apart from the other technologies, other RF technologies that have been introduced in the market previously. You know, TriPollar really represents this evolution from first to second to third generation RF, which Dr. Gold will get into in detail. It is, just so we're all on the same page, it is FDA cleared for non-invasive treatment of mild to moderate facial wrinkles. Now, we use it like we do many other things, Botox being one, other cosmetic devices being others, for off-label applications with the body, et cetera, which we'll get into a little bit tonight. There are approximately 3,500 of these devices installed worldwide. So while this is new to us here in the U.S., this isn't something that is a brand new device that we're kind of going through those growing pains of learning proper protocols and power settings, et cetera, to get effective results. It's a well-vetted product. We know exactly what it will do, and we know what we need to do to deliver amazing results for your patients. It does regenerate collagen, tightens and tones the skin. It also really sees some nice improvement on the appearance of cellulite and reduction in body circumference. And so obviously you use this on both the face and the body. How the technology works is that we're simultaneously heating the deep hypodermal levels and the dermal levels of the skin. Okay, we're stimulating those natural skin renewal processes, tightening existing collagen, and then on the flip side, when we're talking about doing body treatments, we're actually causing the fat cells to shrink by stimulating them to allow the contents to exit, if you will. So I want to just be real clear. We're not killing fat cells when we're doing this, okay? There are some nice clinical studies out there that actually show a rise in glycerol levels, meaning that this whole mechanism of action that's proposed, that by adding heat and heating up those fat cells, we can increase the metabolism to a point where those triglycerides will break down into glycerols and free fatty acids, which allows them from a molecular standpoint to be small enough to pass through the cell membrane of the fat cell. You know, there is nice clinical data out there and peer-reviewed published data showing that that actually is happening, et cetera. So you'll see in the pictures, Dr. Gold speak to his own experience as well, to what we're seeing on some of those body treatments, in addition to the facial wrinkles and skin tightening. What is it that makes this different, and the TriPollar technology different? You know, it's one of these things that's almost again, one of these simple approaches to a complex problem. You know, RF has been used in aesthetics for a number of years. You know, it was first introduced by Thermage. We've had other evolutions since then, from monopolar to bipolar systems. The problem has always been, how do I reach the therapeutic window, meaning 40 to 42 degrees Celsius if we're working on new collagen production, or 42 to that 44, 45 degree range if we really want to increase the metabolism of those fat cells enough to see any significant change in circumferential reduction. How can we do that without putting the patient in a lot of pain? And the engineers at Polygen came up with kind of a simple approach to this, although it's not a simple application, which is increasing the energy field and the density of the energy field underneath the focal area of the handpiece we're working with exponentially to what was available with other systems. And the way they did that was they just simply coupled two negative electrodes to a single positive electrode, rotated those, and so we don't end up with any hot spots developing, but create this incredibly dense energy field that allows us to use lower power on the patient, but higher power density, if that makes sense. So effectively what we're doing is reaching that therapeutic window, in a manner that allows the patient to stay very, very comfortable. When we have patients that are at 45, 46 degrees and we're working on the body and they're completely comfortable, we're monitoring that, which we'll touch a little bit on later too, with real-time thermal imaging. So we know exactly what that temperature is. We're visualizing those treatment areas. So this really does represent a complete evolution in RF applications, if you will. Before I hand things off to Dr. Gold, I'd just like to ask you too. We encourage your questions. We want this to be interactive. As you have your questions or as they come up, if you will simply type them into the question box or chat window that you will see in your little GoToWebinar control panel, once Dr. Gold finishes his presentation, we will address those in the order that they were submitted and hopefully answer all those questions that you have. So with that, I'd like to hand things off to Dr. Gold, who will take us through the crux of this evening's presentation.
Thanks, Travis. Well, you covered a lot, so that makes my life easy. So I appreciate you doing the beginning part for me. And I thank everybody for coming on this webinar. And hopefully by the end of this, you'll get a better insight on the Apollo system. Now, what I find interesting is, if you look at this slide, it says Apollo powered by TriPollar, and down at the bottom by Polygen. I think first and foremost we need to understand who all the players are and what all the names are. So Polygen is an Israeli-based company. Lumiere Medical, which Travis runs, is the U.S. Company that distributes this technology. Around the world, this is known as TriPollar, which means 3 poles, and in the U.S. we call this system Apollo, and I hope that makes sense to everybody, and I hope I get that right. But that's how I understand it, and this is a device that, as Travis noted, is not new. Okay, and if you look here, there are studies that. There are 8 studies on TriPollar and that date back into like 2008, 2009 time frame. I actually first saw this device at a meeting in Asia, and about 3 or 4 years ago. And what was interesting about it is they kept telling me, and I've had all these other RF technologies and have a lot of them. And they kept saying, Dr. Gold, come here. We want you to see this device because it doesn't hurt. And if you're like me and you've lived through the early RF, pain was part of the deal. And if you don't have pain, where's the gain type of thing. And that's how we've always sort of looked at RF technology. And this device, as Travis noted, is painless. And that concept was very unique or very different. So let's go back one slide, Travis. Travis is controlling the slides here. So I want to cover the fact that this device has peer-reviewed literature, and it is, if you're in the market of looking at a device, the first question that you should ask the salesperson that comes into your office is, tell me what's been done with this, who are the investigators, and what kind of studies are you looking at. So let's start at the bottom and work our way up, okay? So and I don't know if you have a pointer, Travis, but I want to start at the bottom. So we would just sort of say, so starting off the humans and looking at this in a skin model. Is the theory correct? 2 poles connected to a 3rd pole and actually see collagen degeneration followed by rejuvenation? The answer is yes. Then we move up, and the journal, again, those that are not used to the Journal of the European Academy of Derm, which is the journal of the EADV, it's a top-class dermatology journal. And again, looking at circumference reduction and cellulite treatments. We'll talk about the next one, which is the histopath a little bit. And then there have been other things. Can we make stretch marks better? Can we do localized fat reduction and facial and body aesthetic treatments? And even the top one, looking at acne. If you heat something, you can do a lot of good with acne. If you heat it and cause a lot of pain, you're not even in the ball game for acne. And what's not listed here, and we'll show one picture of an example, is that in last month's or this month's or last month's Red Journal of the Laser Surgery and Medicine, Steve Shapiro published the pivotal FDA clinical trial, which led to the approval process of this device. And that's important. And so, I mean, there are trials that have been published, that have been looked at, that have been peer reviewed, that show, again, that this device seems to work very nicely for a variety of indications, as Travis noted. And the key is consistency and painless. So let's move on to the next slide. So we see the results. A lot of these RF technologies, will show you a picture of something. Your patients need to get better now. And one of the issues we have with a lot of devices is telling our patients, we're going to treat you, we're going to do this a couple times, but you're going to have to wait 3 to 6 months to see a result. And we charge them a lot of money to do that. Our patients have to see a gradual increase in efficacy as the treatments go on. If they don't, then you're going to have to do a lot of hand-holding and walk through the patients on the technology. With Apollo, your patients will start seeing results usually after the first treatment, if not definitely after the second treatment, and this will be cumulative until they finish their course of treatments. It's a pleasant treatment. Again, it feels like a warm massage. It doesn't hurt. There's no pain. It's non-invasive. There's no recovery that the patients are going to have to do on. As Travis said, there's lots of these machines. I don't remember the number, Travis. I think you said there's 3,500 of these, or there's a lot of these machines out on the market. I mean, the adverse event profile is remarkably safe. And again, if we're not causing pain, we're not heating the skin like some of the other RF devices, that would make sense. No treatment device is 100% adverse event profile free. So you're going to get you can get some redness in the area and some edema and swelling, but that will surely not last more than a few hours to a day on anybody. But there's no pain, and there's no burning, and there's no blistering that I know of that has been reported yet with this. The other nice thing, RF technology is colorblind, so you can use this for all skin types. We spend a lot of time discussing, Caucasian skin in the U.S., but the reality is skin color is more important as far as the total world population, and these devices have thorough testing all over the world, and this device has been used all over the world. My first experience, as I said, was in Bangkok, and so I know there's a lot of what's going on with it. So let's go on to the next slide. So again, I think one of the things that you notice with the Apollo device right away is that there's 3 different applicators that you can use. The one on the right is, and the slide needs to be fixed a little. The first slide is for delicate facial. The first little applicator is for delicate facial areas. The middle one is for medium-sized areas, and then you have this large area that we can treat. But that's nice because, again, all the applicators are there. You don't have to go changing things. You don't have to go, back into the box to find something else and look for other hand pieces because they're all part of the device. And again, that to me is very important. Next. So one of the things that Lumiere has done is they work with this camera, what they call Lumicam. And one of the things that it does, it provides instant feedback. And Travis, you can show with your pointer when the temperature here in the middle is white. That means we're again, based on how this photograph is taken with the references that we know of based on the settings on this Luma camera that we have on this machine, we can do real-time detecting that, hey, we're in this area, getting the temperature to 40 to 42 degrees for the face, or 42 to 44 degrees for the body, and not causing hot areas or skip areas. As you see, this white area is an even area that we're treating. And again, there's some surrounding red, but that red is okay. And then we're focusing on the area that they're. And again, for your patients, it's a wonderful thing. They can actually watch this, and they again, this is part of the wow factor, that your patients can actually say, hey, I'm getting treated, I'm seeing an effect, and that's good. So to me, that this is a really useful thing, and I like this concept a lot. Okay, next slide. So we use it as, for a lot of different indications. The FDA approval is for facial wrinkles, and that's good. I mean, because it definitely helps. But because we know it's RF, and you're allowed to use any device off-label, just so you tell your patients you're using them off-label, that doesn't happen as often as we think it should. And there's no harm in letting your patients know that if you're using this device for cellulite, you're using it off-label, because almost every other device in the category has to do the same thing. And so, this is part of the deal for a lot of the RF technologies. And again, I think you just be honest with your patients and say, hey, I'm using this device. It's used for cellulite, body circumference, circumferential reduction, sagging skin, and wrinkle treatment, and we're going to be using it. And some of the indications are off-label, but we know it works because investigators have looked at it, and it's perfectly safe, and so on. But again, we use it for treating wrinkles and fine lines near the mouth, eyes, and forehead. It can be used for your double chin and any kind of sagging. I mean, if you have any experience with radio frequency, you know that using radio frequency devices for sagging loose skin, is a home run every time you use it, because it works. And again, if I can do this in such a way that it's painless, then I'm a very happy camper. So that sort of makes a little advantage for me. So that's good. Okay, next slide. And again, this sort of gives you the basic skin physiology, which I don't want to spend a lot of time on. But we lose collagen every year. Collagen breaks down. Collagen breaks down. We become age wrinkled and have black skin. That's sort of that's sort of what keeps aesthetic docs in business, this process. But when we use TriPollar or the Apollo device, we get effective skin heating. Again, immediately we get this short-term skin tightening, which your patients can see, and then we get a long-term remodeling. And this remodeling is what gives the patients this firmer, tighter skin appearance that has been shown to be reproducible time after time after time. And it's not like, again, as we noted at the beginning, it's not like we're talking about a device that's 3 months old. This device has been around since like 2008, so we're at 4 years with reproducible results from all over the world. It takes longer to bring devices into the U.S., mainly because of the FDA. Otherwise, we would have had this device a couple of years ago, but it has to undergo regulatory processing and clinical trials and so forth that take time. So it's a lot easier to get devices outside the U.S., harder to get them inside the U.S., but once they're in the U.S., most of us can be assured, that these devices are really tested well, and this one is. So next. Go to the next one. Okay, so again, here's an enhanced imaging system. This is a special kind of camera called the Visiometer, and basically yellow means wrinkled, rough skin, and this greenish color means smoother skin. And you see after a treatment, immediately after, the skin is smoother. Again, if you have this technology at your disposal, which most of us don't, it's very expensive to have, you can show this stuff. Next slide. But these kind of things are important. So this is one of the more important studies that I think you should look at. You should ask the Lumiere people to give you, and sort of sit down with it and say, okay, does this stuff work? And so this was in 2009 in the Journal of Cosmetic and Laser Therapy, and you see two different stains, an H&E stain looking at collagen, and then you look on the right side, figure 7, which is a special collagen stain, where you see normalization, thickening of the collagen from fragmented to tighter, showing new collagen deposition over a period of time, and that's what you see histologically. And so if you see this histologically, then you can correlate it to what obviously you see then on the skin surface. And in this study, they had a 49% thickening or increase in the dermal thickness and focal collagen of fibers, and they had some shrinkage of fat cells. Again, I think Travis noted this stuff does not destroy fat cells. This machine will help shrink them by sort of opening up the membranes to let out all the contents of the fat cells. So your patients, if they go on, they take this treatment and do well, and then they go on a binge eating, it's not going to help their collagen treatments. Okay, next one. So we tell our patients that we need 4 to 6 weekly treatments, and again, as I said, patients should be able to see them. Maintenance is a really big issue, and we get questions all the time on maintenance, and do we need maintenance? When do we begin maintenance? How do you do maintenance? And it's really interesting. If you look at the literature, there is no literature on maintenance, but we all say the same thing. So I tell my patients, we're going to do a series of treatments, we're going to get you better, and then we're going to see how you do. And the majority of patients will actually, with collagen, with Apollo, will actually, at this point, we know they'll last where they are for a long period of time. Now, long could be 9 months, 12 months, 15 months, and then they're going to need another treatment, 2 or 3, to get back into a maintenance program. And then you may need to do 1 a month for a few months, 1 every 3 months, 1 every 6 months. And again, it becomes your call, along with how the patients are doing, to figure out what a maintenance plan is. But you have to let your patients know there has to be some sort of maintenance program built into this thing. Okay, next. So here's the wow, okay? And I think one of the things you see if you look at the treated, go back one. So if you see the treated versus the non-treated, obviously there's decreased wrinkles, okay? That's great. One of the things we all don't do enough of is, at this point in my treatment, I stop. And I give the patient a mirror. And I say, look here, see what you look like. And the wow is there, okay? And then they want to keep going, and they want to get treated. And you've succeeded in taking a skeptic and making him into a believer. You've taken a believer and given him even more motivation. So take a minute every so often, treat an area, compare it to the contralateral side, and let the patient see. It's remarkable what happens. Okay, next. And here are some clinical results. Note the tightening at the jawline. This is a huge phenomenon. You tighten jawlines, you win every time. They are the happiest patients. Necks are the hardest thing to make better, and if you can make necks better without pain, in a series of treatments, most patients will be up for that. This is a wonderful opportunity to make your patients better. And we can just go through these slides. So here's another patient. Again, this is actually from the clinical study that Steve Shapiro did, looking at the decreased lines and wrinkles. And again, another place that this stuff works exceptionally well is around the mouth and around the eyes. And if you look especially around the eyes on this lady, she's got a lot less wrinkles, and that's really important. Okay, next. Again, necks are huge. You make people, we treat people's faces all the time, And I, as a dermatologist evaluating aesthetic patients, we look at their faces, and the patients still have crepey necks, and they have sagging necks, and they have loose skin, and they have wrinkles. Why not treat it like this? You see some, again, great results with this that we can reproduce all the time. Okay, next. And again, here's another neck. And again, don't forget your men. Men like this stuff, especially the painless part. Men don't like pain. It's just one of those things. Women can tolerate much more pain than men, and men don't like pain. And again, this works really well for men. Go ahead, next. All right, and here's one treatment. It's better here. Look, especially looking at the jaw, the neck, and the jawline area. But look at the contour of the jawline after 6 treatments. Again, the patient is exceptionally happy. This is the kind of result you want, and you should get every time you do this with the series of treatments in a painless fashion. Next. Again, another patient. Decrease wrinkles, better skin quality, and tightening of the skin. Next. Again, look here, same kind of thing. Better skin quality, more tightening, much more defined neckline. The jawline is much better defined. Next. All right, and here again, look at the wrinkle, especially around her eyes. They're much better than when we started. Okay, next. And again, necks are great. Every patient, you should be looking at their neck. Go back one. Yeah, you should look at your patient's necks, and you should take that before figure and put it in your hands and squeeze it. Okay, and you'll see it's lax skin. Okay, there's not a lot of fat there, and so therefore tightening becomes a really good option. Non-invasively for this person. Next. Again, an elderly patient not wanting surgery, okay? And, we have a lot of patients that don't want surgical procedures, that want us to age, but, she's in her 70s or whatever, and she doesn't want to look 40. She just doesn't want to look 70s. And again, I think the picture on the right shows a marked improvement in her wrinkles. Okay, next. So again, we use it on the face and neck really well. We also can use it for cellulite, for sagging skin, post-pregnancy, really good thing, bulges in the stomach, all those kind of things. And again, a huge use for this becomes liposuction, texture, and toning post-liposuction. I do a lot of liposuction. I do a lot of laser liposuction. I use Apollo post-laser liposuction and liposuction as a way to smooth out the skin, as a way to make my patient's skin adhere faster back to tightness than just traditional weighting as we used to do. I find it very useful for that. Okay, next slide. Again, this is the CE mark for this system, non-invasive. It has approval in Europe for non-invasive circumferential reduction, cellulite, wrinkle, and skin tightening. Next. And you can see, again, same kind of things, 4 to 6 treatments using the bigger treatment head. And again, the results are pretty uniform over the board. Go ahead. And these are the kind of results that patients can achieve. Will every patient look like this? The answer is no. Okay? If every company shows these kind of pictures and you get these kind of results 100% of the time, there wouldn't be a surgeon left out there. So understand this is a very good result. Patients may not get this much tightening, but they should definitely get something better than the before after a series of treatments. All right, next. And again, this is a kind of thing. I love treating these spots of these grabbing handles on the below the bra areas in women, because you can really make a difference. Okay, next. And arms. Arms are hard. And I always try to explain to my patients when I treat sagging arms, um, you know, not everybody is going to get 100% results, but with Apollo, I'm getting really nice results. And, again, I think this one's pretty impressive. Next. And again, we use this for cellulite reduction. Before and after, this is a lot better. Cellulite's tough. It's not an easy thing to treat. And again, you do need maintenance when you treat cellulite. Next. Okay, and again, post-pregnancy, really nice treatment. Go ahead. If you do these studies on circumferential reduction, and this doc, Ghislaine, is a good friend of mine in Paris, does some really incredible studies, very meticulous in what she does, and we've done a lot of work together in the past. But I mean, you can see here, I mean, this is the kind of results you can get. And again, this is much better in reduction by having the treatment than not having the treatment. Go ahead, next. And again, I think this is pretty obvious, the improvement here in an elderly patient. And go ahead, you can go to the next one too.
Okay.
And somebody that has beautiful facial skin, bad neck, and bad hands. So again, we can use this as a tightening method to rejuvenate hands. And so a lot of people would look at the before image and say, I need to use a filler. I need Sculptura Radiesse to do that. Well, that's fine, and you can get very nice results, but you still have an area of tissue tightening that needs to get done. And so here with the Apollo, again, 2 treatments, you see the nice results here. Next. Okay, and I'll just end with some of my patients. Again, I've been using this device for a while, and I mean, I have some very happy patients with this. And again, they like the concept that it's pain-free. So next. And here's a patient, and again, for more on the circumferential reduction and the tissue tightening. And again, this is wow. This is one treatment. Okay, this is impressive, but the patient needs more treatments, and we'll continue getting more. Next. And again, this is an interesting patient, and again, focus around the eyes, okay? So the eyes obviously are more open, but the wrinkles underneath his eyes are much, much, much better than when we started. Okay, next. And if you look at the contour of his jawline, again, much more defined jawline, and that's what we're looking for. Next. Again, much more defined jawline. Even though this is a little out focused, you still see the texture that we're trying to portray with the jawline. Next. And again, this patient who has lots of wrinkles, is a tough candidate for this, but there is improvement here. Much shallower wrinkles. Go to the next slide, Travis. And you see here again, there's some shallowness to those wrinkles with a series of treatments. And I would like to treat her more to get even more of this improvement. Go ahead, next. Again, just improvement in the jawline area and tightening of the skin. Go to the next slide. Better tightening. This is just after a couple treatments in this lady. There is improvement here around the eyes and around the mouth. We've got more work to do with her, but I sort of want to show you some as we go. Next. Again, I think this is pretty nice. You see the firmness of her skin. That's been improved with a series of treatments here. Again, her eyes are better. Next slide. Again, same kind of thing here. Improvement noted. Skin looks better. Next slide. Again, I think there's difference here, besides the fact that her hair should have been up in the first one. But you see, I mean, there's just the skin looks better. The tightening on the jaw area, you can appreciate much better in the after picture, and the tightening that she got as a result of a series of treatments. Next slide. Again, the jawline definition, much better here, much more defined. Again, that's a home run. That's a happy patient. And again, you see here the improvements here as well. Go ahead, next slide. Again, tightening, better eyes, better mouth. Again, much improved with this treatment. Next slide. All right, and that takes us through my patients and what we've done. I hope that sort of gives you an overview of we're using this face and body and post-liposuction and for cellulite. You know, and again, the reason that this is successful is that it's painless. It's taking 3 poles and it's making it painless. And if you have something that's painless, you know, you have an opportunity to be very successful in this business. So I want to turn this back to Travis, who's going to moderate any questions that you all have, and I'll be happy to answer them.
All right, Dr. Gold, the first question we had was what depth does this RF device go or penetrate to?
Well, I mean, again, the way the system's set up, it's sort of mid to deep dermal and that kind of range. You can, based on how hot you create or the temperature that you gradient that you create under the skin, you can go a little more superficial, but this is really mid to deep dermis.
Yeah, and just as a follow up to that as well, Dr. Reddy, I believe that was your question. We're happy we can email you the studies there on that as well. But you know, we've looked at, you know, anywhere up to 2 centimeters depth of penetration there. So we know that when we're wanting to apply enough heat to actually affect subcutaneous fat, we're actually getting there. You know, a question came in as well, Dr. Gold, about how and I'll put this one out there to you is you know, there's a lot of different devices out on the market, and there's a lot of doctors that will say, hey, this one's the best or that one's the best. So I mean, just as a point of advice to your colleagues here, you know, how would you help them differentiate between, you know, something that there's a lot of things out there that everybody says the best. So how would you make an objective decision on that?
I mean, it's hard because, again, there are a lot of RF devices. And what I tell people all the time, as I said when I started this, check the peer-reviewed literature. If there's no literature, don't buy the device. It's really simple. Those companies that are serious about being in the RF technology have done their homework while they're waiting for the FDA processes to happen. So again, remember, these devices, for the most part, come out outside the U.S. Because it's easier. But it also means they've got to do their homework. And again, without clinical trials that have made it into the literature or that are ongoing here in the U.S., you know, that's the first thing you got to do. I mean, and that'll separate the men from the boys or the ladies from the girls real quick. And then you have to get and try them on your staff and on your, you know, your family or whoever. So do have the device tested in your offices, because again, the first thing that you're going to notice is it doesn't hurt. So, you know, I still remember about 6 years ago here, or 7 years ago, 8 years ago here, the first RF device that came out, I picked 2 of my most stoic individuals, and this was the first device with the original settings, which were extremely high, and I couldn't get through 2 treatments in my office. So that machine never made it into my office. So you have to try these things, and you have to sort of evaluate, you know, is there a fit for them? You know, again, these treatments can take 45 minutes or so to an hour. Is your staff, and if you're delegating it to your staff, are they able to use the device? Do they like the device? You know, is it ergonomically correct, and all those kind of things? Those are things you have to evaluate by touching.
Yeah, no, absolutely, and I think that's a great point as well. Is, you know, we don't our methodology from my company, from Lumiere Medical standpoint, is we've got this seeing is believing kind of tagline we use, but it's true, and that the best thing that could happen is that you've touched 2, 3, 4 other RF technologies, and then you have the Apollo device brought into your office by one of my representatives, and you see it work firsthand. It's backed by all the clinical research that it needs to have before you even gave it the opportunity to come in your door. And then when it does, you'll see what it does. And at that point, I think you'll be informed enough to make a decision that's best for your practice and for your patients. We had a question here, Dr. Gold, of how do you compare the TriPollar to the Accent XL?
Well, Accent is monopolar or unipolar, monopolar. It's one, and they have bipolar. And Accent works really well. And again, I'm not going to sit here and tell you that it's not a good machine. It's a good machine. And again, you have to determine based on your treatments with your patients, how it works and which ones do your patients like and which ones do your staff likes and all those kind of things. So again, I'm not going to be here telling you I don't want to get into comparing one machine versus another machine versus other. Every company is going to have a machine that does something. It's which machine works best in your office and which machine works best with your staff and which machine works again best with your patients. This machine works with my patients. Accent works with my patients, okay? So I use both, but I'm a little on the different side. So I'm not going to bash one versus the other, but again, this one seems to do well.
And just as a follow up to that, I mean, I think it's a point very well taken. I mean, we're talking about RF, and the goal with all radio frequency treatments is to get you to that therapeutic window, which we kind of laid out at the very beginning of tonight's presentation. There's a lot of different technologies, a lot of RF technologies that will get you to 42, 43 degrees. How does it feel for the patient? How does it feel for the practitioner, whether it's the physician, whether it's an esthetician, an MA, PA, et cetera, RN? What's that experience like? And then how does that translate all the way down the line? I can tell you when we looked at the TriPollar technology, we had a concern over, well, there's a lot of RF devices in the market. What is it that makes this one special? Why do we want to launch our company based on this technology? And when we really dug into the clinicals behind it, the science, and then really got our hands on it and saw the difference, there's a reason that that we have very well-established dermatologists, not Dr. Gold, but other derms around the country that already have an Accent in their practice and literally have gone out there, sold it, and replaced it with TriPollar based on the advantages just for them, for their particular situation it gave them. Again, doesn't mean that's a bad technology. It's just that this technology fit their practice better. Question, can you work on breasts or breasts with implants?
You can work on top, above the breasts, sort of in the décolleté area without any issues. I don't work on the breasts with any of these machines, so I probably would tell you can, but I probably would tell you shouldn't.
Yeah.
From a medical legal aspect, I probably would tell you it wouldn't be I wouldn't think that would be the smartest thing to do.
And final question we have is how do you know how long to keep the tissue heated per area? I mean, they're standard protocols we provide you, but I'll let Dr. Gold
No,
expand on that.
again, it's just you sort of work in the area, you know how long you're going to be there, and then you move on to the next area. And again, it's teaching from the guys like from Lumiere and the gals from Lumiere, and they're the ones that are going to show you the right techniques. And this isn't any rocket science. This has been done. You know, they know what they're doing with this. So, um,
Okay, and
shouldn't
then
be a major issue.
just another question came in. What percentage of your patients are getting good results?
All my patients are getting good results. I wouldn't do this if it didn't get good results. So, you know, again, nobody gets 100% of anything. But if I'm not in the high 80s to low 90s, I'm not doing this technology. So, you know, between 85 and 95% of my patients are extremely satisfied.
Okay, great. Well, if there's no other questions, would like to go ahead and keep moving on. We have a couple more slides here to wrap up. Just want to conclude tonight's presentation. You know, again reiterating the results that we get with TriPollar, but you know, rather than kind of going through and rereading a slide to you if you've already seen is I think the most important thing you can do as a business owner, and we all got to be very clear. I mean, your physicians first, and I appreciate that, understand that, and have been in the aesthetics business for quite a while now. But you're also business owners, okay? And as business people, you need to make a good business decision, you know, for your practice and for your patients. You need a system that you know is easy for your technicians to learn. That if your state allows it, that you can delegate. You know, you need something that doesn't have high consumable costs, you know, that's easy to get around. Your ROI is competitive. And I say this as you need this as in this is the criteria we used when we got past the clinical efficacy, the science behind, et cetera, and looked at the marketability of a product and does this make sense for a physician to add to his office? You know, these are the things we really have to look at. And you know, I think if RF is something that's intriguing